On behalf of NASH 24/7, I welcome you to our public awareness program on Break the Silence on NASH. NASH 24/7 aspires to bring best-in-class education and awareness program to serve healthcare workers, patients, and their caregivers. To break the silence on NASH, today we have a renowned gastroenterologist from Mumbai, Dr. Priyesh Patel. He needs no introduction, however, I would fail my duty if I don't mention that. Dr. Priyesh Patel is a leading gastro in Mumbai, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient-centric care. He is currently associated with Gastro Health Clinic, Mumbai, as gastroenterologist and liver specialist. Sir, on this International NASH Day, we salute your dedication towards spreading awareness related to liver health. So now I invite Dr. Patel to enlighten us on the topic. Over to you, sir.
Thank you so much for the kind invitation. And I think we straight away go to the topic of the day. So the whole idea about this topic or the Facebook Live was that we need more awareness about this topic called as a fatty liver or something called as a non-alcoholic fatty liver disease. So in the next few minutes, hopefully we will be discussing the basics about a non-alcoholic fatty liver disease with the emphasis on what needs to be done and what needs to be eradicated completely so that we don't have a disease and we are looking at a healthy lifestyle. So going to the next slide. So since we celebrate the second Thursday of every June month since 2018 by the Global Liver Initiative as a NASH Day. What is a NASH? So it is a non-alcoholic steatohepatitis. And definitely what does that mean? That there is some sort of an injury to the liver which is not related to alcohol. Most of the times what we believe that only somebody who is having active alcohol or significant alcohol will lead to liver damage, but that is not the case. Even if you have not forget about drinking or even if you are not thought about alcohol, there might still be a possibility. And I thank Zydus as an initiative for a Facebook Live and we can deal with the subject in a few slides. So going forward, liver is the second largest organ of the body. Some say it is the largest organ depending on whether you consider skin as an organ, yes or no. But yes, and this is the healthy liver. The diagram is pictorial enough. It is suggestive of a healthy liver in the right quadrant. Next slide. And it has various functions. The most important function, it produces bile so that there is absorption of fat-related substances. It detoxifies the blood and it controls more than 500 metabolic processes along with regulation of blood composition and produces proteins and cholesterol. So most of the times, whatever proteins that our body needs is being produced by the liver. So that means that when the liver is affected, it not only decreases the production of bile, decreases the production of protein and cholesterol, and breakdown of other medications and alcohol will be in a jeopardy. And that is why there will be all sorts of trouble in the near future. So coming to the next slide, a non-alcoholic fatty liver disease is something when we label when there is more than 5% of the liver is occupied by fat. And most of the times the risk factor include obesity or increased weight, diabetes, and cholesterol. So why is it important to us? The most important part is it is important to us because if you notice this, 1 out of 4 people will have non-alcoholic fatty liver disease. So I was using the term NASH and now I'm using the term NAFLD. So what is the difference? I'll come to it in the next few slides. So basically non-alcoholic fatty liver disease is a fatty liver because of in the absence of alcohol where there is more than 5% of fat into the liver. And it is very common amongst diabetes and very common amongst obese people. So that is why it has got more risk factors because the number of diabetics and number of obese people in our immediate surroundings are on the rise. Coming to the next slide. This is a very important slide. I would take a few seconds here. So this is a very good pictorial diagram. Actually, it's available freely everywhere. This is the normal or healthy liver. See the size, see the color, and see the consistency, how it is. Once you have fat deposit over the liver, it becomes fatty. So then we have an arrow here. The liver color changes, the size changes, the contour also changes. It has become more smooth and more rounded and fatty. But unfortunately, if the fat keeps on accumulating inside the liver and it starts damaging the liver starts becoming stiff or fibrotic. So if you compare it with the normal liver, this is the fibrotic liver which has become stiff. And finally, if it is not, progression is not stopped, we reach a stage which is called as cirrhosis of liver, where the entire liver is replaced by fibrotic bands. And this is the liver which is the terminal stage of the liver disease. The good news is that even if you are at an advanced stage of fibrosis, even if the liver has started becoming stiff, there is a reverse arrow. By intervention, we can reverse back to fatty liver, and from fatty liver, we can always go back to a normal liver. So the take home message is we don't have to wait until we get here. Even if we are here, even if you are here, somewhere around here, we have to start in that process that we come to a stage where everything is reversible rather than coming to a stage where nothing is going to help in a certain span of time. So this is the difference I meant by what is a fatty liver and non-alcoholic steatohepatitis. So as I mentioned earlier, most of the time when we do a basic sonography of the abdomen, maybe we were suspecting a stone or some gynec related sonography, or when we are going for some abdominal pain and as a routine checkup, very commonly find a report something called as a fatty liver. And most of the times we say fatty liver to kuch bhi nahi hoga. But that is not the case. As I've mentioned in the previous slide, a fatty liver may progress into cirrhosis and steatohepatitis. So when it is only fat accumulation into the liver, where the liver is not becoming stiff, that is called as a non-alcoholic fatty liver disease. But when there is fat accumulation inside the liver, where the liver has already started becoming stiff, this is something which we are worried about. And medicines are started when you reach in this particular stage, a NASH stage. Otherwise, diet and modification and lifestyle intervention is required in both the things. In NAFL, only a lifestyle modification is required. And in NASH, we require more lifestyle modification along with treatment with medications. Coming to the next slide. So most often the causes of NAFLD, we have discussed about obesity. Some people tend to be obese by genetic workup, increased food intake, lack of physical activity, being exposed to certain long-term medications. We do not know what kind of medications they are, but assuming that they are safe, we keep on continuing. And metabolic syndrome, which includes obesity, hypertriglyceridemia, increased cholesterol, increased waist circumference, and increased blood pressure. So 2 out of 5 will be defined as a metabolic syndrome. So all these conditions will lead to a increased fat deposition of the liver. And if you remember the previous slides, fat deposition going into steatohepatitis, going into fatty liver, chronic liver disease. So how do we deal about it? So next slide, please. So again, being overweight, so most of the times the junk food, and once there is fat, the NASH related to scarring of the liver. So as they say, a picture speaks 1,000 words. So probably whatever I've been speaking, this picture justifies it without me speaking much, I assume. Next slide, please. And there is always an association between NAFLD and diabetes mellitus, with almost threefold increase in the death due to cirrhosis in patients with diabetes and NAFLD. So because of the diabetes itself, irrespective of the weight, there is accumulation of fat into the liver and the liver function starts to damage. And in the same context, there is some sort of an injury to the liver progressing to the fatty liver disease. So assuming that somebody has started with only obesity and does not have diabetes, but has non-alcoholic fatty liver disease, there is a very high chance that is 2 to 4 chance of increasing risk of diabetes. And similarly, somebody has diabetes, there is a 3-fold chance to increase of NAFLD. So these are the things which go hand in hand, and that's why. And the treatment for most of the same remain the same, lifestyle intervention. Go ahead. So what are the symptoms of non-alcoholic fatty liver disease? Usually it is asymptomatic. As long as the liver is functioning well, it does not really cause much of symptoms. Few people do complain of increased fatigue or some sort of vomiting and decrease in appetite. But usually it requires a significant damage to the liver, and then only the symptoms start. Did we finish the slide about the symptoms? Shall we go to the next slide, please? Yeah. So the diagnosis of NAFLD often involves the following tests, includes the blood test, ultrasound, biopsy, and a CT or an MRI. Next slide. So most of the times in the blood levels, we find there is increase in the ALT levels, but usually almost up to 80% of patients with NAFLD may have normal ALT levels. So only blood tests should not be the treatment of or the diagnosis of choice for diagnosing of fatty liver or a non-alcoholic fatty liver disease. Next slide. So that's why we have the most common investigations from here on, which include blood tests include two values, FIB4 and NAFLD. We will be going to the next slide. I'll be discussing it later. Next slide, please. Yes, so this is a very common investigation, ultrasound, most of us know. So this is the, as I mentioned, most of the time it is easily available and economic, and reason for it most often accidentally diagnosed of NAFLD is there. However, the issue with ultrasound is that it cannot differentiate between fat and fibrosis. And to pick up a cirrhosis, it takes a really long time. And by the time the liver is almost damaged to a very high scale. So we need something better. So what are the better tests available? Next slide. So this is one better test than ultrasound in the patients with a fatty liver disease. So this is something called as a fibroscan or transient elastography. What it does, it tells us, okay, is the liver stiff, yes or no, and how much is the percentage of fat inside the liver. So this is a very good idea, and diagnosis of NAFLD with fat greater than 10% is a good chance to find out in fibroscan. And it also differentiates between the liver which is stiff or not. Very easy to operate, just like a sonography. But the problem is only in very obese patients, somebody who's got a very high waist circumference, in those there might be falsely positive reports. Otherwise, it is a very good test. Next test, please. So fibroscan has the added advantage of getting a liver stiffness measurement along with the CAP score, that is a control attenuation parameter, which indicates the stenosis or degree of stenosis into the liver. It is just like a sonography, no need of any invasive test, no needles involved. It is just a plain test and very simple and very safe even in pregnant females. Go ahead. So something which is a gold standard MR elastography, which is a gold standard to detect fat content, and fat as low as greater than 1% can be easily diagnosed. But it is usually not widely available. Only few centers, even in the city like Bombay, are available with the MRI elastography. And it is reasonably very costly because you cannot keep on doing an MRI again and again to know how much is the fat and how much the fat has come down. So definitely it adds to the cost in this era. Next test, please. Liver biopsy, only if the doctor recommends, is a last method. This is the gold standard, but is an invasive test. And only when there is no other option available, we do a liver biopsy. These days, we don't do a liver biopsy. Next slide. So most importantly, we have, what we do is the progression takes years. So as I mentioned, from fatty liver to cirrhosis, it takes years to get. So not everybody will be progressing into that disease, but there is definitely increased risk of cardiovascular ailments. There is increased risk of cancers. There is increased risk of other liver ailments with every progressive stage. So fatty liver may progress to inflammation. Then about 10 to 20% of patients will go to NAFLD. From NAFLD, we have NASH. From NASH, we have NASH cirrhosis. And cirrhosis may lead to decompensation over the next 7 to 10 years and even hepatocellular carcinoma. Going forward. So that is why NASH is not reversible, but initially non-alcoholic fatty liver definitely is reversible. And therefore, it is very, very essential to act before it's too late. Next slide. So what do you do about the treatment options? So this is the most important treatment aspect here. We are not waiting for any wonder drug. The most important treatment is diet and exercise along with lifestyle modifications. You cut down on the fatty food, you cut down on the alcohol and smoking, and you do some regular exercises to reduce weight, there would definitely be improvement to the liver. Few patients will require medications, which I'll be discussing in the next slide. Go ahead. Yes, we have discussed. Next slide, please. So this is very important slide I would like to emphasize here. Just see. So you are at the baseline with a lot of fat inside the liver. If you lose about 3% of your body weight, the steatosis will come down. When it goes further, if you lose 5% of your body weight, then the histological changes will start. If you lose 7% of the body weight, there will be resolution and reversal of the NASH. And when you lose 10% of the body weight, even the stiff liver, the fibrotic liver will come back to normal. So 3%, 5%, 7%, and 10%. Imagine somebody has a 100 kg person and 10% of body weight is 10 kgs. So the person comes from, when he or she comes from 100 to 90 kgs, that is the time he or she will get the maximum benefit. But it does not mean that we have to wait till we get down to 10%. Even loss of 3% of fat is significantly responsible for improvement in liver function and definitely in stopping the progression from the disease of the liver. Go ahead. So what do we do for a healthy diet? Very simple. Most of us know this. We do know everything. Most of the audience knows this, but we do not follow. We are happy with Zomatos and Swiggies and McD's and burgers and Saturday binging and drinking. So basic fruits, whole wheat, grains and beans and legumes on an everyday basis. Weekly portions of stuff like egg and cheese and as much less as possible. Less often of red meats and sweet and avoid that much as possible. And more of seafood if possible for somebody who is a non-vegetarian. Go ahead. Aerobic exercises decreases that something like walking, cycling, skipping, jumping, climbing stairs. These are the aerobic exercises which maintains a healthy weight and improves the cardiovascular conditioning and decreases the liver fat. And if you add resistant training, means increasing the weight, increasing the body weight, weight training, or going to the gym and stuff like that, then reduces the inflammation, improves the glucose absorption, and improves the metabolic parameters with less energy consumption. Simple. Fatty liver improved and normal liver. So fatty liver with exercise, it improves to a normal liver. Go ahead. So most of the times, this is a very meme-worthy slide, if I can tell you. Everybody knows this. I am yet to find out anybody who is into the adulthood and knows and has read well about any subject, knows that these are the basic things and you do not need a doctor to advise you all those things. Go ahead. So there are a few drugs also. Again, I'll just make a small disclaimer. This slide or this presentation is not recommended to start for self-medications. Please visit a doctor, whoever is nearby, and discuss with him or her before you start on any medication. But these are the 3 medications available around the corner, and which include saroglitazole along with vitamin E and pioglitazone. And each one has its own benefits and some sort of risks also involved. But I would like to emphasize on the minimum duration of therapy required. So minimum duration of therapy is at least a year or 2 years is required. It is not a 1-day course. It is not a 1-month course. It is not a 3-month course. You have to take medicines for a extended period of time under observation from a good doctor near your house, whoever you trust. That is the basic take-home message from here. Go ahead. So tips to prevent fatty liver disease, basics. Limit intake of saturated fats and trans fats. Obviously, quit smoking. Have a balanced diet. Exercise regularly. Limit consumption of refined carbohydrates. Limit or avoid alcohol. And maintain a healthy weight. Go ahead. So this is a small initiative and we are open to questions from here on as a NASH initiative in baseline. And if there are any questions, I'm happy to answer. Go ahead. Thank you. Thanks. Thank you, Mr. Bhargava.
Thank you so much, sir. I would like to thank you from on the behalf of NASH 27 to you for this wonderful talk, and this has enlightened us. Now we will take questions from the audience with your permission. So we have a question that is there any cure for fatty liver?
Normal fatty liver?
Is there any cure for fatty liver?
There is definitely a cure for fatty liver, and there is diet and exercise, diet and exercise, and diet and exercise.
Right. So with proper diet and regular exercise, we can reverse this.
We can definitely reverse. Yes, fatty liver is not a disease. Only a fatty liver, when it progresses to a certain stage, that is a time we will have what we say problem, and that is a time we have to start it prevent it from going further.
Right, sir. And next question that we have is what are the symptoms and when to visit a doctor?
So most of the times the symptoms are not related to fatty liver, though people may attribute sometimes that they feel a lot of fatigue and less of energy. but fatty liver may not have a conventional symptom. The liver by default is a very resilient organ, so it is a good thing and not a good thing as well. It's a good thing because it is a resilient organ, it does not create any symptoms, and the bad thing is because it does not create any symptoms, we do not start the treatment or do not are not alarmed immediately, and we wait for the liver to get damaged to almost a very high degree, and that is the time the symptoms start. And when you have stages of fibrosis, that is the time you have symptoms of vomiting with blood, yellowish coloration of eyes, fluid in the abdomen or fluid into the feet, and dark colored urine, and altered sensorium. But I think the most important symptom is that there is no symptom at all, and we just have to have regular checks. See, most of us, most of the people who are 30, 35, or 40 and above, they are worried about a cardiac health. They are worried about heart, and every time there is a gas issue, they go to a heart specialist, do a ECG, 2D echo, and whatnot. But I think liver is a silent organ, and it requires some sort of a respect. And with the obesity pandemic that we are living in, we have to be more vigilant by finding out whether we have a liver disease, yes or no. And in that regards, we will be starting on the treatment depending on whether we start NASH के लिए vitamin E or Bilipsa or semaglutide or pioglitazone or any other drug in the market depending on patient to patient basis.
Right. Thank you so much, sir, for this lively and informative talk. As you have been emphasizing the awareness for liver health and disease, it is equally important for people affected by fatty liver to regularly visit doctors and continue medication. With careful observation and precaution, it is possible to obtain control on the disease. I would also like to thank our audience for their active participation and patience in making this event successful. Stay connected with NASH 24/7 on Facebook and take care of yourself and your family members. Thank you.
Thank you for